Prognosis EMR Specialty Input Templates Overview. In this video, we're going to look at specialty input templates. Specialty templates are used to document patient interactions that are not covered within the standard E&M level of service. This would include any procedures, tests, or screening examinations that are beyond a standard review of systems or physical exam. Specialty templates are accessed from an open encounter under the Table of Content menu Specialty label. As regards the features of a specialty input template, these can be set to auto-populate to an encounter when the patient is marked arrived or be manually chosen by the user based upon local workflow and configuration. In addition, specialty templates may be defined to include grids, which can be invoked as needed based on local workflow. You have the opportunity of copying forward templates from a previous visit and then making modifications as needed. Accessing patients' past medical history, face sheet, document list, or associated doctor form in a non-mobile pop-up. In addition, an op note is automatically generated in real time while the procedure is being documented. And finally, ICD-10 and CPT HCPCS codes can be defined to auto-populate the assessment and therefore flow automatically to the claim either from the template or at an element level. So I've logged in here to Prognosis as Dr. Cooper, and we're going to take a look at a couple of examples of specialty input templates and these different features and behaviors. The first one, Donna Paulsen, we're going to notice that the template is pre-populated. So I'm going to choose specialty here on the left-hand side, and we see the nebulizer treatment template is already present. Now this is an option based on local preference and workflow setup. In the case of Donna, I've got an encounter type asthma patient, so my nebulizer treatment is auto-defaulting to my encounter. That is one of the options we have where you're able to define which specialty input template you would like to auto-default to the encounter, either at the encounter type level or at the HPI level. In addition, templates can be defined to always carry forward at the design level, or within the provider specialty master, you can also set which specialties you want to automatically copy from the previous encounter. Now if I go back to my home page and choose a different patient, this time I'm going to open up Mike Ross and choose specialty on his as well, we'll notice there is no template pre-populated, so I can manually choose it. Now when it comes to manually choosing my templates, up here in my select template I have an autocomplete master file lookup. As we've learned in previous videos, this means I can start typing the name of my template, or I can click on the binocular and do a template search. This of course gives me the broader capability of searching by the classification I may have assigned. Maybe I'm looking only for an examination template or a procedure template, or maybe I've classified my templates another way based on my local workflows. A third way in getting a specialty input template to populate an encounter is to copy one from the patient's history. Up here in our icon row in the upper right, I have the copy icon. And that displays a list of all of the previous specialty templates that this patient has had in conjunction with other visits. So I see that she's had a couple of other nebulizer treatments. I might want to just bring one of those forward from history and then just modify the values for today. In doing that, notice that all of the values come in a yellow color. Similar to our color coding on the face sheet, that yellow is to visually indicate the information is being copied forward from a previous visit. Now regardless of which option you choose, whether the template auto defaults, you manually choose it, or you bring one forward out of history, completing the documentation within the template itself is going to be the same. I'm going to reselect Donna Paulsen and open up her specialty template again and administer the nebulizer treatment. Now another video discusses the convention of our different result types, which you can see here by the different icons and field colors present on our input template. And most of those behaviors are universal throughout the system, regardless of what category. So I'm not going to spend time on how to fill out the template in this video. I do want to just mention these other options up here in our icon row. We're going to look at the CPT HCPC in just a few moments. But these first three buttons are called grids. There's another video here on the Resource Center that deals with configuring and using grids. But a good example would be intraoperative vitals, when you need to do multiple occurrences of something at the template level and be able to compare them. We've also got the opportunity here through non-modal pop-up functionality of accessing the patient's past medical history. We can actually open the entire default face sheet. We've also got the ability of associating a doctor form with our input template. So maybe there's something else that we need to document at the same time as our procedure. For instance, we want to go ahead and fill out our physical examination or order a prescription. And then finally, we have our document list. If we need to access something, perhaps look at previous radiology results or diagnostic studies or something to help us in completing our procedure today. In the context here of our specialty templates, however, we want to focus on the behavior of billing codes, and that would be both diagnoses as well as CPT and HCPC codes. First of all, we're going to look at diagnosis. You'll notice the first element here on my treatment template is today's diagnosis, and it is a master search lookup with the binocular. Down here at the bottom, however, I have another question also called today's diagnosis, and it's a predefined list of values, which also shows the ICD code as well as the description. The difference is the set of values, although predefined with the code, will not flow over to the assessment and therefore will not be mapped to your claim. Whereas if I choose my master search, I can choose either from my preferred list. I'm just going to go ahead and take the asthma with exacerbation, but I also have access to the rest of my diagnosis functionality here. And because it is a master search lookup, the ICD will automatically flow to my assessment and be mapped to the claim in conjunction with the property being set to the appropriate values. So now when we look at our assessment, we'll see the asthma with exacerbation has populated the assessment, and as long as it is flagged as billable, it will also automatically populate to our claim. However, the one that I chose from my multiple choice did not. And that is because of the behavior of the set of values is different than the behavior of the master search. Now with regards to CPTs and or HCPC codes, we have two different levels of default or optional, both at a template and or at an element level. So your options with regards to getting the appropriate CPT or HCPC on your assessment as well as on your claim depends upon your local preferences as to which option works for you. During design, you can assign CPTs and HCPCs to automatically default at a template level, which means simply by saving the template, the CPT HCPC will go to your assessment. And we can see that here with Donna. If I open the assessment and go to the CPT HCPC tab, we see the nebulizer treatment has automatically populated. And if I follow my eyes over here to the source column, the abbreviation SPL indicates specialty template. So that lets me know that at a system level, I have hard-coded this CPT code that whenever the template is documented, that code is what will get billed. Now back here on my input template, if you notice up here at the top, I also have a button labeled CPT HCPC. And in this example, my button label is white. If I click that label, I have additional codes available to me that I can also select. This means that during design view, I assigned these codes as being optional. An optional code requires a user to choose which code they would like. So for instance, if I want to go ahead and choose J7611, if I go to my assessment, that code will also show with a source of specialty template, because again, it came from the template level. The only difference is that this one was optional, meaning I chose it as a human while documenting the template, and this one was hard-coded so that it defaulted automatically. Now we also have the option of defining our CPT HCPCs at an element level. What we just covered up above was overall to the entire template, such as a procedure where regardless of the details of the procedure it's still the same code. Sometimes, however, you need to be granular to the result level, such as the specific medication. There's going to be a different J code for each one. Or in the case of DME, there might be a different supply code for each piece of equipment used during that procedure. When doing it at the element level, because the code is attached to the result, once the user chooses a value, the CPT or HCPC will automatically flow to the assessment in conjunction with the system property being set correctly. As we discussed in the Creating Input Template videos, there are several result types that could be applicable. We have the master search, similar to what we discussed earlier with regards to the diagnosis. We see that, I scroll down here a little lower, for my question administered via, my binocular opens up my CPT HCPC master. And if I do a search for mask nebulizer, I can choose that HCPC code through my master search. And if we look on our assessment screen, it has auto-populated. Notice this time, however, my source is TMS, which means Test Master Search. If I go back to my template, another choice would be at a predefined set of values. We can see that here again on our nebulizer treatment with the administered via. If you notice in my set of values, I have the choice of either the mouthpiece or the mask. So if I, for instance, decide to choose the mask, when we go look at our assessment, the CPT code comes over for the mask. This time, notice our source says test instead of specialty. That helps us to distinguish that instead of being at a template level, it's actually at the elemental level. So again, it's hard-coded system-wide, but it's based on the answer we've chosen. So now, if I go back to my template and instead of the mask, I choose the mouthpiece and go look at the assessment, notice it's changed from mask to mouthpiece. Again, the source being the test. So you can have a specific CPT or HCPC code per answer when you're doing it at the elemental level. Now, a final feature we want to look at here in conjunction with specialty input templates is that of the associated output. Now, within prognosis, we refer to this as the procedure form, but many refer to it as an op note. If you notice here at the bottom, we have both the option of printing it or previewing it. And if you decide to preview it, you can also print it from in there. So I'm just going to click my preview button. Now, there's numerous options to formatting as far as your output. And that, of course, is covered in a separate series of videos here on our Resource Center. In this example, we've just got a simple narrative and paragraph form that's wrapping all of the elements together to indicate the breathing treatment. This op note or procedure form is automatically generated in real time as you're documenting, and it is saved to the patient's document list. So if we click over here on Donna's document list, in addition to the progress note and all of her other documentation, we see that there is a procedure form for the nebulizer treatment. So it is automatically part of the medical record, and it's up to you if you want to also include the details in your progress note. So in review, specialty input templates are accessed from any encounter from the table of contents specialty. These are used to record procedures, examinations, and services rendered beyond the standard E&M level for billing. Specialty input templates may auto-populate to an encounter, be copied forward from a previous visit and then modified or manually selected by the user. Specialty input templates include features such as grid tests where applicable, the ability of accessing patients' past medical history, their face sheet, their document list, or a doctor form by means of non-modal pop-ups, and the op note is customizable and auto-generates in real time as your procedure is documented and becomes a permanent part of the patient's medical record. With regards to billing codes, these may be assigned to either auto-populate to the assessment or be manually selected by the user, and this may occur at the template level or at an element result level.